Existing measures include a 50% sitting capacity limit on all public transport buses, the suspension of all wedding ceremonies and other festivities, as well as the enforcement of a countrywide curfew from 8 p.m. to 4 a.m., except in Musanze district of the northern province where the curfew begins at 7. Despite this, COVID-19 appears to have accelerated its rampage and people are worried. We are very afraid these days because we heard that it is a serious illness that affects a person's breathing, which is why we must protect ourselves by wearing a mask and practicing social distancing. Things have gotten much worse of late, and we hear of many new infections daily, and the fatalities have also drastically increased. We are worried that a person may use illegal ways to get around and end up among us, infecting us. That worries us a lot. The last 20 days have been particularly bad for Rwanda when it comes to COVID-19, with infection rates and deaths because of the pandemic seeing highs previously unknown in the 9 months the scourge has been in the country. With 65,268 tests carried out, 1,844 infections were found and 44 people ended up dying from the virus, and active cases rocketed from 739 to 1,823. That means fresh infections increased from 3.3 to 3.7% in the span of just 3 weeks, and fatalities increased from 0.8 to 1.2%. Health experts point out that there is a reason for this. The measures that were initially implemented were so successful, people became complacent, thinking that we were all somehow immune to the pandemic, and so infection rates began to spike. If people continue on this path and fail to realize that we must all play our part in properly implementing these measures, the pandemic will eventually overrun us. You have seen how in the last 2 days alone, it has seemed that things are getting out of hand, with 6 or even 7 people dying in the space of 24 hours. We saw nothing like that at the start of the pandemic. We went for more than 3 months without a single fatality. There is also a problem of people contracting the disease and then mistaking it for regular flu. People are mistaking COVID for regular flu, especially now in the rainy season. However, flu symptoms are the first sign of COVID, and so I urge anyone with symptoms to think of COVID before they start thinking that they have a regular cold. People are going to pharmacies and buying regular cough medicine to deal with the symptoms, when in reality all they are doing is going around spreading the virus, and by the time they are finally properly diagnosed, they have infected many people, and that is what is worrying us most. And this is why health officials in Rwanda have continued to insist that as long as a vaccine is not available in the country, preventive measures must continue to be respected. COVID is still with us, and even though vaccines are available and have begun to be used in some other places around the world, we do not expect to get one tomorrow. That means we still have an extended period ahead of us in which we must continue protecting ourselves and fighting the spread of the virus. Only such measures can enable people to continue with their regular daily activities and developmental efforts. But if they fail to respect the preventive measures, then certainly some things will be affected, because more infections mean more restrictions that could have been avoided. Since March last year, when the first COVID-19 case was detected within Rwanda's borders, more than 8,600 people have been infected, with more than 6,700 recoveries and more than 100 fatalities.